Welcome back to Ruff Talk VR. Dive into your weekly dose of in-depth game reviews, exclusive developer chats, and the freshest scoop on MetaQuest and the VR universe. Today, we're in good hands with the dynamic father-son duo D-Scruffles and Stratus, ready to decode and discuss all things virtual reality.
Hey, welcome to this episode of Ruff Talk VR. Today we have a small little deviation from what we normally do.
Going out of our personal comfort zone.
Yes, normally we stick to gaming, whether that's reviewing games, talking gaming news, or interviewing developers. But I know it's been a request of yours for a while to kind of explore the medical side of virtual reality. Yes. We know it exists. We've heard people talk about a bit, but we've never had somebody in depth to talk about it. And then one of our most active Discord members, one of the moderators there, huge part of the community, Amelia, she said, hey, I heard this person talk. You got to get her on to talk about some of the uses in virtual reality in healthcare. So today we're joined by Tammie Hyde. She is a nurse anesthesia practitioner, but
that's a short version.
Clearly she has some experience with virtual reality. Like I said, we're deviating a bit, but we're still keeping it to our main niche of virtual reality. Yeah. So Tammie, do you want to introduce yourself a little bit more for our listeners and tell them a bit about what you do and how that brings in virtual reality as well?
Yes. Nice to be here. I'm a nurse anesthetist, a CRNA, and I find that most of my patients are more afraid of the anesthesia than they are of the surgery. They're worried about, is it going to hurt? Am I going to wake up? And the great thing about virtual reality is that it really does help relax and calm them. And so that's where I got into virtual reality.
And how did you discover it as a medical use as an anesthesiologist?
We want to try to minimize our use of opioids because of the opioid epidemic, and people get nauseous and they want to vomit when they take things like fentanyl or morphine or Dilaudid. And I was looking for an alternative way of providing some pain relief for these patients. And that's where I stumbled upon virtual reality. My background isn't in gaming, but I was reading these articles, and it was Dr. Hunter Hoffman. He developed Snowworld back in the 90s, and he was actually the first person to use virtual reality for treating pain. And there's these pediatric kids who had large areas of their bodies burned, 40, 50% or even greater. And if you've ever even seen it on TV, if you're not in the medical field, burn wounds are extremely painful. You have to do these dressing changes. And it's horrific for the kids. It's traumatizing for the people who are doing the dressing changes. And so when I was reading his studies, he had these kids that were, reporting less pain with their dressing changes. And they actually started to look forward to their dressing changes. And actually just started to describe them as fun when they were able to get into virtual reality through this snow world. And it's really cool. There's snowmen, and you're throwing snowballs at them, and you're splitting around, and you're dodging this and dodging that. And it really brought tears to my eyes when I'm reading this, and that's what I wanted to bring to my patients. That pain relief, that comfort, that ability to make a very horrific, traumatizing experience less so. And so that's how I got into it.
How has it been received from like a patient standpoint? Are you having to like really sell them on the idea of like, we don't want to give you traditional necessarily, lifetime supply of pain meds. So we'd like you to try this, and it's going to.
You've been surprised. They're actually very interested in it. I tell them this is something to supplement. If they need pain medicines, I will absolutely give them what they need. It's not like I'm going to be stingy and withhold it. If they need it, they get it. Okay. But once they get it on and they use it, their time just flies for them. What seems like what's 30 minutes to us, they're like, wow, it was only like 15 minutes. It cuts their time in half of how they perceive something takes. And so, they're actually, I did a study on virtual reality for dental anxiety. And, you know,
That would be me,
dentists.
by the way.
Yeah, it's very persuasive. I mean, people who are afraid of the dentist are very afraid of the dentist. It's not just, there are people that were in the dentist chair after the procedure and they were like, "Do we finish this out?" I mean, how many people voluntarily that are afraid of the dentist just want to stay in the chair for, you know, an extra 20, 30 minutes to finish their session?
So that's huge. I mean, again, the concept of virtual reality for healthcare in general, it seemed obvious to us, but we've always been curious, like I said, how it's actually used.
Implemented.
So for yourself, at what point is the virtual reality implemented? It doesn't sound like it's being used as they're being put to sleep for surgery or anything like that. At what stage is more for like the post-pain treatment and stuff like that?
It's a variety. So you have the preoperative phase when people are sitting around in the preoperative area and they're worried about the surgery that's coming up. Currently, we don't do that at our hospital, but there are a lot of hospitals that are doing that where they can just put on virtual reality and chill. When it's their time, they go in, go to sleep, have your traditional surgery. For what we're working on is actually for peripheral nerve blocks. So this is where we inject a local anesthetic, kind of like at the dentist where they inject local into your gums. And so we're doing it into the neck, into the legs, depending on where we're doing the surgery. And it's a temporary discomfort, 15 minutes or so. It's not very long, but you don't necessarily want to give them a ton of narcotics for a short procedure. So we'll let them, you know, use the virtual reality headset, you know, do this, and then they can come out of it when they see fit, when it's time to, you know, take them back to the OR. There are places that are actually using virtual reality during surgery. So if you're doing, let's say, a knee surgery, you have a spinal, you can't feel anything below your waist. And they're using virtual reality then instead of a general, like a light sedation. Typically, if we do a knee surgery, we might do propofol, little light sedation, twilight. But instead, they're actually working with patients who are just using virtual reality instead.
Yeah, I've actually had knee surgery before. And I'll tell you right now, I got high off my ass. I got knocked out, not only with obviously the anesthesia, but for anybody that's never had anesthesia before, it's not like a dream state of sleep. It's like you can do a countdown from 10, you're going to be asleep by 3. If you're strong, probably like 6 realistically. And then a blink later and you're back up. There's no like, you go to bed, you can sometimes feel that 8 hours. It's not like that with anesthesia. It's like, it's done and then you're back up. But before that, yeah, you get shot up. I know I got the nerve block on my leg.
Mm-hmm.
And then yeah, they give you, at least me in that situation, a plethora of what I was described to me as a cocktail of stuff. I remember the nurse being like, "Oh, this is a good one. You know, you're going to enjoy this." And then you get the anesthesia, and then you still have some of the effects when you come out. I imagine both from the anesthesia, but also, you know, the other amount of drugs that were shot in. So if you could mitigate that putting to sleep and be able to just be in virtual reality that whole time, I mean, that's one less potential.
It's amazing me that the mind can separate that strongly to be able to block out any sort of pain or discomfort. I'm not saying even 100%, even 50%. I mean, that's pretty incredible.
Mm-hmm.
Well, we do this with a spinal, so it's not like the virtual reality is doing all of the pain control.
Correct.
So the spinal takes care of the pain. It's the virtual reality takes care of the anxiety of being there.
Okay.
Yeah. Even if you can't feel the pain from the spinal block, if you could see yourself getting cut into, that's no.
No. There's drapes. We don't let people watch that.
Yeah, for sure. So, you know, I think that's really fascinating. But for yourself, you have more firsthand experience with it.
The peripheral nerve blocks. Yeah. And then we did have a surgeon who was using the HoloLens with an MRI image, and he could overlay the MRI image of the patient's shoulder onto the operating field. And you'd see him just kind of doing this, and he's like twisting it and getting it lining up so that he could visualize what he's doing in line with the MRI image.
That's amazing.
So cool. I got to see it, you know, just the computer screen of what he was able to see. But just so totally cool as to what the surgeons are actually using it and able to do that. Yeah.
That's
I talked with the
remarkable.
neurosurgeon at the Meta Center Global Week last month. And he's actually a neurosurgeon, so he's actually able to overlay the MRI of the spine or the ultrasound image and see when he's ultrasounding, able to see it as he's looking at the skin. Instead of looking at the ultrasound over there, he's actually able to project the image onto the surface, which is just crazy.
That's remarkable.
Well, this is an area for like mixed reality. I never,
Yes.
never even conceived was, but it seems to have practical purpose. So I knew my mind was going to be blown a couple of times during this.
Oh yeah, already. I mean, we're 10 minutes in, and it's really cool to hear the potential ways it's used preoperatively, during operation, post-operation, or potentially used. Like I said, you're doing it more pre. And in your firsthand experience, what's the reception been like? Has it met your expectation of how you thought it would be received, or what's the reaction been?
It's incredible. There's a few people who are like, no. Once they get it on, their mind is blown. And I love seeing their reaction to it. Because anytime I can make them more chill, more calm, it makes my job a lot easier. And then I just love seeing them just abased by it. I mean, anywhere from, the young folks, I kind of expect them to be into it. But when you see this 85-year-old guy who is enjoying it just as much, I mean, if not more so, it's almost like they seem to be more blown away by the ability to do this. And I'm just amazed at how people are accepting of it and welcoming of it.
I can't help but feel like you're on the kind of cutting edge of this kind of technology, but am I correct on that? Or is it much more commonly used in the medical field than,
you just don't know about it?
Yeah, than maybe my perception is. Or are you much more on the cutting edge?
I think for we're in my area, yes. If you're at a big academic center, they're using it. Children's Hospital out of Denver, Colorado, they have child care specialists and gamers that's their role, is getting games to the children, whether it's virtual reality or just other types of gaming platforms. And they're using it rehabilitation, just to pass the time, get these children connected to other children who have maybe their same diseases. There's one that's really cool that they have. It's called Gurney Journey. And it takes the child from pre-op area. They put on the headset. It's like a mixed reality. You get to see your parents. You get to wave goodbye. You see this portal. You go through the portal, and you're now completely virtual reality. They're able to wheel you down to the OR, do an induction, which is where with children, we typically will put a mask on and let them breathe the gas that way so we don't have to start an IV on them. And they never see the OR. They don't see the path of them going to the OR. They wave by through the parents, and they are instantly in this field of animals. And
I imagine that brings down anxiety, especially for a young
tremendously.
Kid,
not only for us, but for the parent. The parents don't like to see their kids crying when we walk off with them.
Now they're maybe even excited to go
scary,
by.
Dude. You always see people in hospitals and in beds, and some of them are in a lot rougher shape than you are. And there's tubes and there's machines and things are beeping. And I'm an adult in the hospital, scare the hell out of me. So I can't imagine being a kid and being comfortable with knowing that you're going in for a surgery.
And I can't help but feel like morale and like being mentally positive is so huge in those situations, for the patient as well, just for outcome.
Positive mindset, I would think, is really important.
So I can only imagine, that the potential for it's huge in all areas of it.
Then I would think less stress for the staff.
Yeah, 100%.
Surrounded the person, because now they're not feeling that emotion of like wishing you could do something for.
And is this hardware like medical grade virtual reality headsets, or is it like
sounds
Oculus
like they have
Quest?
custom stuff here?
I am using Oculus. I'm actually looking at getting a Pico headset. But yeah, they're Pico, Oculus.
Wow, that's amazing that, when this type of technology comes out, even if it's geared for gamers or whatever, it has a huge trickle effect into walks of life that you wouldn't expect.
This is an area that I'd hoped virtual reality would come into play.
I think for the anxiety reasons, it's huge. Like going back to the dental anxiety one, you referenced that's something that,
dude, if there was a way that I could go to the dentist and they're like, hey, we got your special program to watch, Mr. Happy Tooth, whatever it is, then yeah, I mean, obviously, I'll still go, but it's under like total duress. And if I can cancel, like, oh, I got a sliver, I can't come to then I will.
And are these experiences that they're getting put in, is it like, are they watching a movie? Is it just being in a beautiful environment? What's kind of the environment that somebody gets put into?
Well, when I read the literature, and that's something I actually looked at when I did the dental anxiety study. When you read the literature, a lot of them are saying, I use this, I use that, I use this movie, not offensive comedy. And I was almost feels like we're throwing dirt randomly at the wall and just see what sticks. And so when I did the dental research, I actually got into the patient's experience and what are the components that we need to address to make a better environment. And one thing I had always theorized, didn't think I would be lucky enough to see, but I actually got to witness it, was we always say beach scenes are calming. Put people at the beach. Almost everybody talks about, let's go to the beach. Well, this lady was doing Trip. I used the Trip software, and it was the scenes of Portugal. And it goes from the mountains of Portugal down to the water side. And when I got to the water side, I noticed her kind of sitting up and almost backing out of her chair. I was like, what's going on? I had it cast to my computer so I could see what she was seeing. What's going on? Are you okay? And she was afraid. She's like, I can't tell where I end and the water begin. I was like, how immersed do you have to be that you're afraid of drowning when you're in a dentist office in a dental chair? I was like, okay. So I fast forwarded through that and got her back to land. And there was like a little stream. And I'm like, is this okay? Is the water stream, is it just a fear of water? She's like, oh no, that's fine. There's a waterfall. That's fine. And then it went back to the beach. I was like, oh no. But the second beach scene had little pillars. They were maybe a foot or two high, almost like a little fence, but not really a fence. And she's like, no, that lets me know the water won't get to me. And so we really do need to consider what environments we put people in, because it's not effective if they're so immersed that they're afraid of the environment.
Yeah.
Yes. So that is something to consider, is what do we offer our patients? Because we don't want to trigger an anxiety attack over something else.
I love the fact that you have an actual research study done utilizing this for dental anxiety. Are you able to talk a little bit more about like your results from that? I know you referenced.
Yeah, I was curious about percentage of.
Yeah, I know you gave
success,
some.
I guess
it sounded positive outcomes, but you're able to touch a little bit more about like the overall results of the study.
It was, again, it was a qualitative study, so it wasn't huge numbers of patients. I had 17. All of them would use virtual reality again. One actually suggested I use it in the waiting area versus just in the dentist chair. The drops in anxiety were definitely significant. Those with the highest level of dental anxiety dropped the most. So they actually got the most benefit from it. But even those with small levels of anxiety improved as well.
That's freaking cool.
Good enough results.
It is.
17
really
or
cool.
1700, you could make the argument you'd probably get similar results. So,
and I could totally see that the more anxious you are in general, the more the result is. For somebody that doesn't really suffer from dental anxiety, it might not even be a benefit to do it. They might just be better off just going off in
any
regular,
distraction for someone like that works. Even the TVs that you see now on the
100%.
ceilings, there's a reason why they're there.
They're there, yeah. Well, and it's great about virtual reality is because you're blocking the view completely. You're not having to see that needle come towards your mouth or that dental instrument come towards your mouth. Or, some people might just have social anxiety and not know, do I make eye contact with my dental hygienist or do I look away? You might feel a little awkward at having somebody stare at their face. And this just completely, knocks that out. Because I used an Oculus headset. And so I told them, if you can tap twice if you want to get a pass through and see what's going on. If you're worried, you don't have to, rip off the headset. And nobody took me up on let's look around because they got worried. They were just, once they were immersed.
And so did you have to teach yourself how to use the Oculus and everything like that? Or did you follow videos? How did you learn all of the nice tips and tricks like double tapping and casting?
I just played around. I just played around with it.
That's awesome.
Just ordered it and said, okay, what can we do?
It's really good to know that you don't need, like I joked, specialized, medical VR headset. It can work with just consumer standalone headsets. And
it's the experience that's going to be the most important.
100%. And I know it's hard to speak for the entire medical community, good luck, but in your experience in talking with people and doing, the talks that you do, does it feel like the medical community is overall receptive to virtual reality being used, or is there some resistance you meet?
There actually, it's funny because 3-4 years ago when I was doing my study, I mentioned it to some of people who are now my colleagues, and they had never heard of it before. Virtual reality, what's that? Or they had the perception that virtual reality was just for gaming. And then, slowly, as I've been talking to people, they're becoming converts as they hear about like what I've done and what I've been able to see and people I've talked to. They're definitely much more open to it now than they were just even a few years ago.
I think this is just the start of, we're far from the tip of the iceberg with the possibilities. Mm-hmm. What makes me excited is since we started the pod, it's like I've always wanted to hear some medical story of VR because I can see it in my head. Like there's capabilities, there's possibilities, probably even get to the point of remote surgeries, which they currently do anyways in some capacity. So imagine being on the other side of the world, but in a VR headset and you're right in front of the patient. Working the little robot arms. I simplify the process, but to me, there's a vision there that you get
call the consultant who's on the other side of the world, and that specializes in a particular technique, and
you don't need to
take over the robot. Yeah,
you don't need to fly out just to get brain surgery. I say just to get, but it doesn't need to be hurdles of geography.
Would you allow your doctor to have a big fluffy tail?
Yeah, why not? As long as it's a good surgery, as long as my outcome is good, right? That's all I care about.
Got the headphones out and the fluffy.
If I make it out alive and healthy, then I'm.
I think this
good.
is just. I can't be more excited to see where this is all really gonna. And it seems like all the. Are you finding any negative side to this at all? It seems like it's relatively been a positive experience in the way it's being
been
used.
A great experience. When you look at side effects, which the most common thing being like cyber sickness. I had 2 people have that during my dental research, and it was because they were spinning the world too fast. and they noticed, and they self-corrected it right away. They're like, "Whoa, that was a little fun," and slowed it down. And they, without any input from me, were able to completely, say, oh, "Okay, that went too fast," and just slow it down. And even though some of them had pre-existing motion sickness history, they did completely fine. There's a couple other research studies of young kids and older adults that say the side effects are very minimal. And if you do have side effects, stop it. We can always take the headset off and do something different.
That was actually going to be my next thing. I was going to ask about other studies and stuff, whether it's through yourself or colleagues or just you hear it through the grapevines. Do you hear about a lot of, studies being done now for virtual reality?
Oh yeah, there's journals just dedicated to XR type therapies. You got the JMIR Serious Game, and then the AMXRA has just started their own journal as well.
That's
for
huge.
these therapies. Yes, it's absolutely huge.
It's not just publishing into not random journals, obviously credentialed journals, but dedicated just for VR. Really shows
Which
you
means
how
they
big.
intend on growing that knowledge base, so the market's becoming viable.
Yeah. Ooh, this is.
I don't want to say I get scared with medical shit, so it's like exciting things for medical stuff, but it's going to be better for all parties involved.
Mm-hmm. If it gets people, because a lot of people, they're scared to even go to checkups and the doctor, and it's not about what happens once they're in there. It's just that you can't get them into the building to begin with, and if that helps alleviate that burden, and somebody goes, "Oh, all right, I'm going to go to the doctor, but I get to be in this environment, or I get to watch this and pretty much, 3D IMAX, it's might be an easier sell to some people." So I'm excited
and
to see.
Stanford's doing a lot for mental health. They're looking at treating patients with mental health issues. The psychologists, psychiatrists are doing therapy.
Is that research? Is there anything published on it, or are they still? It's still too early to say about.
They do have several things published.
Does it sound like it's going good? Does it sound like?
Yeah. When I'm in the group meetings, it sounds like they're having great results. They got virtual reality for hoarding, smoking cessation, weight loss, group therapies that you can do. All.
Wow.
Yeah, virtual reality, doing nutrition, teaching people how to shop and reading nutrition labels through virtual reality programs. It's absolutely incredible what they're doing out there.
And, having a reputable spot like Stanford investing in it, that causes a trickle down effect. It's one thing if it's, some random spot, whether or not, even if it's good research, it's just very reputable coming from Stanford. So that's awesome to hear that it sounds like we're in like the sparks of a fire stage of like, there's some stuff, it's in the early works, but I can imagine in 10 years.
Wait until it becomes competitive in the university scale. I mean, we all benefit as consumers and in the industry at the end, but there is like industry competition and university competition to be the first and the best. So if it can spark more little ambers around the country for people to invest in the program, then my brain can't even conceive now where it really could go, because I'm already blown away with where they're currently at.
And to use yourself as an example, did you discover virtual reality when you were still in school? Were you already in the workforce? When it...
I had been in the workforce as a nurse practitioner for decades. When I went back to school to become a nurse anesthetist. And that's actually where I discovered it, as a nurse anesthetist student.
So that's a great example that it's like all these, not kids, all these adults in medical school right now, wait until this wave of people is out in the wild and they all have this cutting edge experience. We're in for, like I said, the next 10 years we're going to see some cool stuff.
They'll have focus skill, like that's what you'll go to medical school for, for the virtual reality health and wellness program.
Already anticipating it.
Yep. I can totally
see they
it.
already have virtual reality in the education. You got like for anesthesia, we have Symbana, which is a program where you can manipulate the anesthesia machine in the OR and see, if I do this, what happens? If I do this, what happens? How do I change this out or change that out?
And is it pretty accurate too? Like in the...
See,
it's incredible what you can do with this.
I love training simulators in VR. I actually bought one that I'm like, and they give you tests and
it's
stuff.
It's an airport simulator to be a bag handler.
Outside, you're the outside guy. So it teaches you all the steps you would do. But in theory,
absolutely not a game.
No, it's 100% a simulator. You don't. There's no fun factor to it. It's like going to work. But if I had the opportunity to like do an open heart surgery simulator and it was true to form, I'd be all over that. I don't expect my patient to do well, but over the course of time, if I was really dedicated, maybe I'd figure it out. Maybe I would. So I would get my hands on any of those.
Yeah, 100%. And I
would
guess
kill a lot of patients though.
To change gears, have you heard of other cool use cases for VR in the medical field that we didn't touch on yet?
Well, they're doing patient interviews. They're having virtual patients. So they're teaching students how to interview patients. And the patients are programmed to respond certain ways. Did they ask the question? How did they ask the question? And give different responses based on what questions were asked. Which is cool because, I mean, it used to be you have to pay these people, pay models to show up and to learn your interviewing skills. Now you have a sim that can be programmed to do your interview.
That's huge.
Yeah, the integration for both patient and the learning aspect to me is probably now going to be a bigger push, just because again, easy and who you can learn from. I mean, you can sit in a classroom, learn a lecture, but you might be able to take the best in the world and get them into an environment like that. Then,
and you're doing quite a bit of talks about VR. Is that true?
I've done a couple.
That's awesome. Really
went over to Belgium, and whenever my virtual reality with dental anxiety research. And then San Francisco, I did a talk. Hopefully, I really want to bring more of this knowledge to the anesthesia world because it's something that is just a huge potential to really improve our care.
No, I agree.
So you're right now are pioneering the
cutting edge,
the movement, I'll say, to get the word out there that this is Jesus.
It's just another tool in our toolbox. Why not use it?
Well, and if it works and it's got statistical proven results, then 2%. If it's anything with medicine or I'll take 2% better. So I don't need 100.
And it doesn't have to work for every single person. But if there's a group of people that it works for that are now getting an enhanced experience,
dude, the mental disconnect that has to take place for that to being enjoyable. That's awesome.
Yeah, I love to hear how immersed the lady got. But
You're worried about drowning.
Yeah, but I remember the first VR experiences too. My hands used to sweat if I climbed.
Dude, what if they threw you next to an edge? Remember that vertigo feeling?
A shark go by you, like whoa,
yeah,
whoa.
So I totally get the balancing act of what's going to be enjoyable to the patient and what's. So is that going to become a whole thing too, where they'll like want to know what's your preference of, like, I'm scared of heights. I don't.
No spiders.
No Yeah, no dark alleys.
Well, what about dogs? People love puppies, right?
True.
Not everybody.
True. No,
people are afraid of dogs. Maybe afraid of drowning. What if you're claustrophobic? You might not want that forest scene. But if you're agoraphobic, you might not want that open scene. You might prefer the forest scene. So, I think the developers could definitely have a huge input in developing scenarios that allow us to pick and choose and maybe offer a nice rounded content.
Yeah. And I
was just thinking, wait until a developer does focus exclusively.
Exactly.
I am 100% for
this is for medical.
Polling hundreds and thousands of doctors and nurses to get the overall. You could really crush it in
correct, because if you're having results with Trip is a great app. It's like a meditation app.
Holy moly.
Really good at virtual environments, but it's not specially made just for this use case. Wait till you see apps that are. Oof.
Yeah. It's a little clumsier for the older population to pick their environment. You're in the OR or pre-op, whatever. You just want to, it's always go, right?
Yep.
So you don't want to have that restaurant menu that has 50 items. You want that well curated 1-page menu. that, is well done, but, fewer selections so that, your meat dish, your chicken dish, your fish dish, your vegetarian dish, your vegan dish, and everybody's happy.
That makes complete sense.
Keep it simple.
Yeah. No, I'm excited to see where all this goes. And, our listeners know we always joke, we record on Sundays, so we steal people at the best time of day. But I don't want to wrap this up without talking with you, because I know this is something that you are so excited for. So I'm sure you have a couple more things you want to ask Tammie before we. I
already got more. I already took in more knowledge than I thought going into it, because I had I'll say a little percentage of maybe some insight as to what Tammie's involved in. And I heard the burn story. That's the one that got me the most. I'm not going to lie, because I unfortunately, as a kid, Time Life used to come out with these yearly hard books, and there was some tragic fire, and I got to see pictures of the children in the burn hospitals, and I asked my mom, what are they doing? And it's well, she gave me the breakdown of how they clean wounds and the whole, and I'm like, this is unfathomable. So to hear that there was any betterment, aside from dental anxiety and the fact that someone with a burn injury could potentially escape that pain while it's being performed that's what really, really, really stoked my interest in. Because from what people have told me, there's probably no pain you'll experience worse in your life than if you go through, especially if it's a large percentage of, you're not talking a little, I burned myself with some,
I touched a hot pan.
Yeah, you're talking big percent. It's pass out pain levels. So my brain instantly couldn't conceive, how can you make that disappear? Mm-hmm. On top of whatever else they can provide.
Beyond disappear, kind of look forward to it as next level.
Horrific pain. So I just, for that alone, I was blown away that they're able to alleviate some of that for kids, and I'm guessing adults too. But no, this exceeded anything. This is two episodes we've had where I'm leaving with a lot to digest.
Mm-hmm.
I have more to digest than I thought I would.
And maybe it's not the last time we'll hear from Tammie either.
No, I'm hoping we see Tammie really spearhead this across the country and internationally to, not telling you to quit your day job, but, if it's
this is my day job.
Yeah. Right. Keep advocating for XR is what he's saying.
Truly, it's also nice because it truly reaffirms that people in the healthcare industry really actually do care about these patients. It's not just a 9 to 5 to them. It's anything we can do on our end, and even being enough to go, look, opiates, some people probably shouldn't get them on any long-term, just by genetic design or whatever, but we can now offer something that's going to help them is huge, because it really does validate that people, it's not a business. It's people care about other human beings and want to make a bad experience as best as they can, which is weird, but if you can alleviate it, then. So no, dude, I got more stuff answered than I wanted. My notepad's half full, and I'd love to see where this is going to go throughout the years, because this is literally just the start of this evolving. So if Tammie would be nice enough to come back on someday.
I'd love to come back and share my final research results.
Well, I think
absolutely,
it's positive. I don't see. I don't hear.
I'm
any
looking
negative.
forward to it. Yes.
And if I know you're not probably tearing up the social media scene, but someone might be interested in trying to find information about anything you might be putting
or see
out
one
there.
of your previous talks or something like
Correct.
that.
Is there a way for people to do that? Or is it
out there? I'm on LinkedIn, Facebook.
It's out there in the wild, like we always do.
It's out there in the wild. Yeah.
Yeah, I did see your LinkedIn.
I'll have to work on a website at some point. And I actually want to develop a website just for posting this information for people to find. But
that's what I was hoping for.
Yeah. Well, hopefully that'll be stuff we can talk about.
Well,
when we get you back on.
The interest is going to generate. Especially in the
we're in the infancy of it. Yep. It's only just begun. I think that it has potential to be really.
And the quicker it's mainstream, the better. So when I need to go to appointments, I'm less inclined to have a reason to skip them.
Basically, selfishly, you want to go into a waiting room and get in a VR headset, is what you're saying.
Yeah, and I don't want anybody to suffer anxiety and pain management in itself is.
Well, again, I said it before, but it's one thing for the people that are already going, yes, but there is a population that ignores it because of anxiety completely. So if virtual reality could be something that could get them in too, that's huge, even just for that percentage. So,
well, they should also give them a kickback for selling headsets, because I'm sure there's a percentage of people that liked the experience and regardless would probably want to do that in their own home. So that's they're funny. Also introducing people into the VR world.
But I can't say it enough, Tammie. Thank you for taking the time to talk to us, especially on a Sunday. I look forward to seeing how this side of things continues to
this
grow.
Is dude, I want to keep following this, because now that we know there's somebody on the inside that knows what's going on, we have it in. So.
Yeah. And thank you to our Discord member moderator, Amelia, for recommending this one. This was a fun one. For anybody that enjoyed the episode, subscribe, rate us 5 stars. Stay tuned for next time, and enjoy the rest of your day. Ciao, ciao.
Take care.